She gave it a 4 paws up rating. And I want to just read, I'm trying to push this book. I want to read to you her review. She said, places our noses and tongues have been describes the many interesting things these 2 witty canines have sampled from the outdoor world over the years. The book illustrates that despite the author's adventuresome lifestyles, they have remained free of infectious, allergic, and autoimmune disorders, unlike many super clean humans that spend their lives inside scrupulously clean Western homes. And after reading this insightful book, one has to ask, so, just who is the dumb animal now, Mr. and Mrs. Homo sapien? A most compelling read. I noticed that the NHA is not carrying that book. We'll have to work on that. Okay. So, you know, children need to have earth connections. That's a very important thing. And children, another study, children that have been raised close to the earth, such as those who have been raised on farms, have demonstrated a significantly reduced susceptibility to allergy. Yeah, they need to play in the dirt. They need to play in the dirt. That's not an earth connection. See? Little tubby kid there sitting playing video games, you know. And these games are so violent, most of them, too. I was telling one of my classes, I was teaching a public health course at Life Chiropractic College. I said, you know, we're really not doing our kids a favor. We're generating a generation of kids now. They're growing up playing these games, you know, hours a day, these very violent games. I said, it does affect their minds over time. And this kid in the back of the room, this 22, 23-year-old kid, he raised his hand, he said, damn, doctor, that is such a pack of lies. That is a lot of BS. He said, I play those games all the time. It doesn't have a GD thing to do with violence. I said, yeah, well, there you go, point made. You know, we take all these antibiotics, and rather than getting exposed to all these bacteria, you know, I worked for a probiotic company actually in Florida part-time for a few years. And, you know, you don't have to necessarily take probiotics from a bottle. You can get them from things that you eat. And when we take antibiotics, we're altering our bowel flora, but it does more than just make us subject to opportunistic organisms. I see people who are dealing with health problems today that resulted from antibiotic usage that they did decades ago that they never really recovered from. They took multiple courses of antibiotics because they alter immune responses in your gut. You've got 75 to 80% of your immune system located in your gut. That's where it's at. So it makes us more subject to allergies and related immune problems. The effects antibiotics have also in increasing the risk of asthma and hay fever have been directly linked to their negative influence on early colonization of the gut, bacterial colonization of the gut in the early years of life. So antibiotics have really become kind of a dietary mainstay. The amount of antibiotics taken in our population is reflected by the number of antibiotic prescriptions written for kids, which is about 700 per 1,000 children seen in the medical office setting in 1999. So 7 out of 10 kids that walk in the medical doctor's office are going to walk out with an antibiotic. I shared office space with a family practitioner. We had separate practice, but I shared office space for 20 years. And I know that's true. It was usually antibiotics or steroids. It's a mainstay of medical practice, unfortunately. And very few people escape exposure because the chiropractors can say, oh, well, we don't take antibiotics. I say, oh, really? Do you drink milk? Eat chicken? Well, yeah. Okay. Then you're getting antibiotics, and sometimes even in a more insidious and deadly way that way. Because 70% of the antibiotics produced in the United States are not given to humans, they're given to animals. And so when you drink their milk and you eat their meat, it's not just the ethical problems we have with the tremendously inhumane way these animals are raised and slaughtered, but also what are we doing to ourselves, not just from the problems with the milk and the meat itself, but also the residues of the antibiotics that are in the milk and the meat. When we have lifestyles that limit microbial exposure, we create repercussions that create this very escalating autoimmune and allergic disorders. And so a lack of earth connections creates the diversity of biological and autoimmune problems for us. And what is autoimmune disease? We said it's disease that occurs when the body tissues are attacked by the immune system. And there's, just to show you, there's some of our autoimmune diseases by sight. A lot of people don't even know they have autoimmune diseases. They don't realize there's 130, 140 different autoimmune diseases, all of them becoming more and more prevalent. There is the rheumatoid disorders, all of which are considered autoimmune in nature. And there is a list of those, a partial list. Multiple sclerosis. Look at this. Poison bee, this is in Journal of the American Medical Association. Poison bee et al. Found that higher infant sibling exposure to microbes in the first 6 years of life is associated with a reduced risk of multiple sclerosis, possibly by altering childhood infection patterns and related immune responses. Diabetes. Worldwide, the tropical regions of the world having the most infectious and parasitic diseases, in other words, those people that are probably in most connections with the earth, are least affected by immune-mediated type 1 diabetes, that's so-called adult onset diabetes, and other autoimmune diseases. It is the fall in the incidence of infectious diseases and intestinal parasites that are actually likely responsible for the rise in autoimmune disease like immune-mediated diabetes in the West. In other words, our lack of connections with the earth. Inflammatory bowel disease. Gent et al. Tested the hygiene hypothesis in a matched case control study, looking at variables involving domestic hygiene with patients having Crohn's or ulcerative colitis. The study concluded that good domestic hygiene may protect from exposure to a full range of agents that program the immune system of the gut during infancy. The authors predicted that improved hygiene in developing countries could lead to increases in Crohn's disease, which is exactly what we're seeing. I'm almost done for today, by the way. A couple more slides here. Evolving out of a chronic disease condition, that's what I'm going to talk about tomorrow, which I titled The Will to Get Well. Unloading a chronic disease condition. Evolving out of a chronic disease state requires time, a strong will, correct action, and focused concentration of the business of getting well. All essentials. And patients have to make choices, just like my dog has to make choices. Do we scratch on the door or do we pee on the rug? Right? So tomorrow we're going to talk about the will to get well. I'm going to carry on with this thesis a little bit of connecting with the earth, talk with you a little more about earth connections and how they can apply in a very specific and practical way in getting rid of chronic diseases. You've been a great group. I think you all ought to go do some Tai Chi with Dr. Sabatino now. Thanks very much.